We are so grateful for Dr. Ezike as our keynote speaker today. Dr. Ezike is the director of the Illinois Department of Public Health. She's a board-certified internist and pediatrician who joined IDPH from Cook County Department of Public Health, where she served for more than 15 years. She was also the medical director at the Cook County Juvenile Temporary Detention Center. Prior to joining CCDPH, Dr. Ezike served as the Austin Health Center medical director, where she actively engaged with the community on a variety of health initiatives. She's also delivered inpatient care at Stroger and primary and preventive care in community and school-based clinics. She received a medical degree from the University of California at San Diego and a bachelor's degree in chemistry from Harvard University. Dr. Ezike also holds a management certificate from Harvard Business School and is an assistant professor in the Department of Pediatrics at Rush University. Dr. Ezike is a national policy advisor on juvenile correctional health topics and has presented at numerous local and national conferences for medical professionals and youth audiences alike. Throughout the pandemic, Dr. Ezike's voice, message for the state of Illinois has been an informative, professional, constant presence that has supported our free and shareable clinics and our patients. And we welcome Dr. Ezike to our annual conference.
Thank you so much. Good morning, everyone. Happy Monday. Thank you, Executive Director Melissa McGuire, the Board of Directors, staff, and the member and participating clinics that make up the Illinois Association of Free and Charitable Clinics. I am honored to have this opportunity to join you on the occasion of your 10th annual conference and bring a few remarks. We want to address the opportunities that stand before us at the beginning of this new decade, looking at the new challenges that we find ourselves facing in this era, and of course, exploring and searching for new solutions to those challenges and the challenges that we don't even yet know about. This is a challenging time for every single one of us. However, we know that there are solutions out there. We also know that we have a job to do, not only as the public health entity for the state of Illinois, but as the entity whose work is carried forward by a network of healthcare delivery systems. And were it not for your presence within this network, more than 100,000 patients across the state would go without access to quality healthcare. So I salute you. I tip my hat off to you for what you are doing, for your mission to improve access to quality healthcare for those individuals who are uninsured or underinsured or somewhere in between, and for all of the work that you do to build the network of clinics and healthcare services for all of Illinois. Because clearly we are not whole, we are not healthy as a state unless all the individual members within our state are whole and healthy. So thank you so very much on behalf of the entire public health family for all that you are doing for the people of this great state. So as we talk about the new decade, let me first look back at what we have to celebrate from the past decade. The 2010s were a decade of drug breakthroughs, everything from cell therapies and gene therapies to an RNA revolution, and much of that work has driven just where we find ourselves today. We also consider the advances made in effective immunotherapies for cancer and cardiology advances, HIV advances, and even cutting edge research in Alzheimer's disease and sleep disorders, multiple sclerosis, and big breakthroughs in diet and nutrition. The challenge, however, comes when you look not only at the costs of these advances, but also at who exactly they benefit. When viewed through the lens of equity, who benefits from these advances? And that's part of what we now look at in this new decade, recognizing the technologies and scientific breakthroughs that we've achieved during the past 10 years. But now the challenge is to take those breakthroughs and make sure that they are accessible to all patients and in all healthcare delivery systems, not just those systems that are at the far end of the spectrum with regards to being, top tier, Cadillac level, top price, but also to those free and charitable clinics and programs that benefit the large majority of the people and not just the quote upper echelon of our population. Now, before I get too far ahead of myself, let me pause and acknowledge the elephant in the room. Of course, we're talking about COVID. I can't not mention the quote novel coronavirus and the disease that it causes, COVID-19. How do we apply what we've learned during the last decade and bring it into this new decade in light of what we've seen as we have tackled COVID-19? Let's level set first. Yesterday, in the state of Illinois, we reported now a total of 1.3 million cases of COVID-19. And within those 1.3 million cases, we've had over 21,600 deaths. As of this weekend, 2,127 people were hospitalized, are in hospitals in Illinois right now with COVID-19. And so these are still troubling statistics, even though we know at one point at the peak, we had over 6,000 people in the hospital in a single day. So yes, we think there's light at the end of this tunnel, and that light continues to grow stronger every single day. We do now have vaccines that are safe and effective in combating COVID-19, and that has dramatically changed the outlook for our state and for our nation. In Illinois, we have administered more than 8 million vaccines across the state, and that milestone was just achieved yesterday. So when we talk about a new decade and new challenges and opportunities, this ongoing battle will be at the top of the list. In 2031, as the next generation of IAFCC members gather and chronicle another decade, they will note that the challenges faced included the search for a vaccine, the research being conducted even as vaccines were being administered, and the degrees of inequity in the delivery of healthcare that came to light as we came face to face with hard statistics that clearly showed the disservice done to marginalized and underserved communities for generations. 10 years from now, IAFCC members will look back and say, in 2021, we leveraged the advancement of new technologies and scientific breakthroughs achieved in the last decade with respect to healthcare. We amplified the role of social determinants of health and the role that they played in the delivery of healthcare to disparately impacted and marginalized communities. And we created opportunities for better engagement with our FQACs and free clinics to address the needs of underserved communities. Now, in order for those future free and charitable clinic members to craft their narrative in this way, we must begin today to tackle the challenges of rebuilding our disparately impacted communities in a post-COVID-19 environment. And this is where I feel your work is so critical, so essential to the recovery of our communities. By ensuring we have the appropriate funding to meet the recovery effort, as well as those ongoing service provider coverage needs that will directly target and address the specific needs of all of our communities, and especially those that are disproportionately impacted. And by working harder to regain the trust of the community members that have traditionally felt that their concerns and needs have not been heard, only then will we really achieve the goals that we all commonly hold. Let's be clear, there are a large number of historical disparities that were in existence prior to COVID-19 that created the health conditions that we see now that lead to ongoing poor health outcomes. According to the 2020 Health Disparities Report for Illinois, poverty levels have always been higher for minorities especially Black children living 100% below the federal poverty level. In terms of insurance, the highest rate of being uninsured is among Hispanics at 18.2%. This high disparity can be attributed to mistrust of the system, concerns about immigration status, uncertainty about navigating the healthcare system, language barriers, and lack of culturally competent service providers. In terms of income inequality, it is highest in Blacks, not just in Illinois, but nationally as well. Let's talk about life expectancy. On average, there is at least a 7-year difference. In some instances, an 11-year difference for Blacks versus whites in some Illinois communities. And there are similar disparities for Native Americans. In terms of education, Blacks in Illinois attained less education than all other races and ethnic groups and had the highest high school dropout rate. These disparities do not make for a very uplifting or motivating report, but like our battle against COVID-19, there are new solutions and there are strategies. Beginning today, now at this conference, let's commit to intentionally partnering with faith-based organizations, community-based organizations, community clinics, and the like to implement programs focused on solutions to address the unique challenges we face now and those lurking around the corner. Supporting culturally and linguistically appropriate interventions and initiatives that match our community's actual needs. Also, making sure our funded programs are reviewed and approved through an equity lens. I'm so proud to share what we're doing at IDPH. At our department, we have recently enacted an equity checklist for grant applicants, and 35% of the overall application points for scoring purposes are attributed to this checklist. So if your programs do not have these underserved communities in mind, have not consulted with these communities, have not engaged in these communities, we will be looking for other places to direct our critical dollars. Also, improving access to healthcare through equity-focused vaccination clinics, flexibility in working with community and vaccine providers to eliminate barriers to registration and vaccination, and utilizing mobile units for support and expanded wraparound services, taking quality healthcare and services straight to those who need it most, rather than waiting for them to come to us. And finally, committing to improving the granularity of data collection with respect to race and ethnicity so that we can provide better data visualization for all end users. Again, thinking the year is 2031, and as the 20th annual conference is called to order, and as the meeting begins, members will marvel at the list of achievements made in the last decade and will be inspired by the work that you did in the face of a pandemic, in the face of social unrest and systemic inequity. They will move forward, pledging to continue the work that you are undertaking now, strengthening it, fostering it, educating and advocating. Because, as you know, the real ongoing challenge is the ultimate elimination of health disparities and the availability of accessible, quality healthcare for all populations. So thank you for allowing me to kick off your 10th anniversary conference. And I look forward to working so closely with you as we tackle the real challenge and craft a blueprint for successful solutions for the next generation and those that follow. Thank you.
Thank you, Dr. Ezike. Those comments are so motivational and so empowering for our members who, you spoke so clearly to their passion and their dedication to the uninsured and the underinsured in Illinois. If we have any questions in the chat for Dr. Ezike, we have some time that please, the free and charitable clinics, as you probably know, are not short for stating their thoughts. They are amazing, providing that healthcare with a volunteer provider mix of providing really effective healthcare. And as you spoke so eloquently about, they have adapted and adjusted to COVID and done many, many amazing things. So I would open it up if anybody has any questions for Dr. Ezike. I'll throw one out for tomorrow when our clinics or it's for Wednesday. So they've had kind of a day of networking, a day of getting, some content, your amazing remarks. And as somebody kind of starts this important journey to Wednesday, do you have any kind of suggestions, supports, comments for our providers as they, are integrating your great comments, looking at the direction, going forward, going back to their clinics? Any kind of thoughts that you can give our participants today?
Well, we know that all the participants have the right heart and they have the right mind. And so what we need is to make sure that we are working with the community in mind in terms of hearing directly from them. All the best intentions, if they are not aligned with what the community actually wants, they're still well-intentioned, but they're not going to achieve the desired goal. And so we just need to continue to have the actual community, their representatives, seated at the table, telling us how we can improve, how we can set that blueprint, how we can better serve the people that we want to serve. But it's really only from active listening. That's why we have 2 ears and only 1 mouth, so we can spend twice as much time listening than we are just talking and dictating, and just carrying that forward in all that we do, listening to the people that we care so much about, that we're hoping to serve, and hearing from them how they want their care delivered, in what manner, where we can improve, how we can adjust. And it's already a nimble group that's able to do it. So we just need to make sure that that target population has the audience from us.
Excellent point. I have one question in the chat, and one is, based on what you've seen globally, how do you feel our COVID surge is looking?
Well, as we all know, no community, and that means no state, that means no country, and our world is not safe until everyone is safe. And so we can celebrate that 8 million shots have gone in the arms of people in Illinois. But if you think about a country like Haiti that has not administered a single vaccine, that tells you that that country and other countries that haven't seen a single dose, what the virus is doing in those places. It is mutating freely, varianting freely, and we also know how quickly that variant can show up on our door again. And so given that the variant is only as far away as the, nearest cruise ship, plane, train, bus, whatever, we have to have that global look. We have to care about what's happening in our neighboring states. We have to care what's happening in countries near and far, and have that global look and understand that we are only as safe as the least safe amongst us.
Thank you. I have another question in the question box. So this is, first of all, it's been an inspiring presentation. Free and charitable clinics seem to be our state's best kept secret. So what advice might you offer us to raise awareness about the important and unique role that free and charitable clinics play in Illinois?
That's a great question. And really that there are so many great secrets that need to, come out from under and be shown in the light. So, IDPH definitely has a role to play. All of state government, that is seeking to serve all of Illinois, but particularly focused on those who need the most assistance to achieve their best health, their best life. We need to partner with you to make sure that we are sharing the good work that is done through, I think Health and Human Services, that portfolio, Department of Aging, the Healthcare and Family Services, HHS, IDPH, the Housing Agency. We all need to be sharing, that important information through our social media channels. We need to partner with you as you have events. We need to try to magnify that. We need our traditional larger healthcare networks to also be touting the great work that you've done. So it's an all-in Illinois approach. We all need to be celebrating all the work that's done in the different corners, knowing that every single part, every single network is part of the bigger solution.
Great. And what I would say is feel free to refer anybody to our website, illinoisfreeclinics.org. We have a whole list of all of our free and charitable clinics in the community throughout the state. So when your providers or the providers are looking for direct partnerships with a clinic in their area, they can go to our website and find a clinic, and we would love to have them reach out to the state association as well. So we're here to partner and do this together. We're all in this together.
Absolutely.
Then I have another question about the time frame of getting free so there's questions about eye care and IDPH and vaccine. So actually, I think this is a two-part question. We've been working with our clinics to get set up in eye care, but I also think there might be another resource in a way for our clinics to get access to vaccines through partnerships with IDPH. So whether either we can answer it today or we can get back to our members. Is there a way to do an overview of resources for our clinics for vaccine, either through registering through eye care and or other initiatives through IDPH that our clinics can tap into?
Right. So we're trying to create many different solutions to the same challenges that we all hope to overcome. Yes, for sure. A clinic can register to be a COVID vaccine provider, sign up and register to be, in eye care. We are quickly coming to the point where, all clinics who are registered to be COVID vaccine providers will be able to share in that effort. One of the rate limiting steps is how many different locations can handle, the ultra cold storage, and the freezing temperatures that are required, and the size of the, for instance, the Pfizer comes in over a 1,000 dose, packet. So being able to take a whole tray might be a limiting factor. So if that might not be the best solution, then partnering with another organization where just, an appropriate amount of doses can be shared with one of the, the free clinics, a dose, an amount that they can handle and then be administering. That is absolutely something that can happen now. And if that's not already happening, I definitely will take that back to my team to see how we can incorporate you into this effort, because we know that you are directly targeting the population that we are so desperate to ensure that they get the vaccinations as well.
Thank you. As you know, many of our clinics, as you have said before and affirmed, our clinics are the trusted healthcare providers for those that are so marginalized and resilient in our state. And then I think, I'm not sure, are there thoughts or efforts where IDPH could partner with the clinic and actually have a vaccine event at the clinic? So the clinic is kind of the host and IDPH. I'm not sure if that's an actual model.
That's the thing. No. I mean, we have been having events at union halls, at churches. We absolutely can have it at a clinic. We have a team that, would do a site visit, that would make sure the setup is planned well in advance, figure out the resources that we might need to import, figure out what the resources are that are on site. That is absolutely something that can be done. And then your teams could, appropriately publish and ensure that your patients would know to come in on that day and take advantage of this resource. Absolutely. So we absolutely will talk online and work on making this come to fruition immediately.
Thank you. And our last very good question is that resource-strapped clinics are overwhelmed meeting the needs of their patients, especially now as they're trying to test and vaccinate patients. What would you say to our members, our clinics that are struggling to find the capacity to prioritize equity, right? What are kind of your thoughts, encouragements, resources for our clinics today?
No, I mean, we have to be realistic. We experienced the same challenges at the state. We were not equipped or appropriately staffed to even handle what we were supposed to be handling pre-COVID. And so to effectively ramp up, it wouldn't have been possible without the federal dollars, which allowed us to contract with all these different individuals, bring on the appropriate staff. So, I mean, realistically, we have to look honestly at what can be done and not spread ourselves too thin, where we kind of do a half job instead of doing a few things well. And so I would think that maybe we look at the array of clinics and say where, okay, maybe testing will be done here, and maybe the vaccination effort will be here, because we want to do what we need to do with that equity focus. And the truth is that those equity projects, like, they're a grind. It's rapidity, and just doing anything quick is simple. Trying to get those specific groups takes much more intentionality, as you all know. And so it has to be like a focused effort, but spreading ourselves too thin probably is not the right solution unless there is the additional support to be able to do all those things well. So I would say focusing and doing something really well is probably better than doing a lot of things, half.
Very wise. Yeah. Do you ever end your day and you say, like, it's almost like I started so many things, and what did I finish? And then when I kind of circle back, I can kind of see a beginning, a middle, and end. There's an evaluation piece in there. There's a learning, and it's a challenging process today in the midst of pandemic, isolation, and serving patients and serving the community that has been, really marginalized and is experiencing a lot of health disparities. So your wise counsel for our members is really important. We have a few other specific questions that, in order for us to stay on time, if it would be okay with you, if we could kind of summarize our questions and send it to you and or your staff. Specific things about immunizing children and outreach to the homeless. We have a really, as you know, community of knowledgeable, passionate healthcare providers. But to be respectful of your time and your great remarks, could we summarize these questions and send them out to your staff, and I could get back to our members with these responses?
Absolutely, absolutely.
So again, I just want to, on behalf of our clinics, the patients they serve, and now we're adding the communities they serve, right? Prior to COVID, I would say our clinics and the patients they serve, this really, they are serving our community. So on behalf of our clinics and the patients they serve and the communities they serve, we just thank you for your valuable time that you spent with us today. You kicked off our conference giving us important information, motivating us, challenging us, and partnering with us. And for that, we're so ever grateful. So thank you, Dr. Ezike.
Thank you so much for having me. And this is just the beginning. We have lots of work to continue to do together, and we will make sure that happens.
Thank you very much.